Testosterone is much more than just a male hormone. It's a vital chemical messenger that plays a crucial role in both men's and women's health. From building muscle and bone to influencing mood and libido, testosterone is essential for overall well-being. As we age, it's natural for our testosterone levels to gradually decline. However, some individuals experience a more significant drop, leading to a condition known as low testosterone or hypogonadism. This can have a wide range of effects on your physical and mental health, impacting your energy, mood, and even your relationships. The good news is that low testosterone is often treatable. By understanding the symptoms and seeking timely medical advice, you can take control of your health and regain your vitality. In this guide, we'll explore the signs of low testosterone, simple ways to test your levels, and effective strategies for boosting this essential hormone. Remember, knowledge is power. By arming yourself with the right information, you can make informed decisions about your health and live a longer, healthier life. Low testosterone can manifest in a variety of ways, often mimicking other common conditions. This can make it tricky to pinpoint the root cause of your symptoms. However, being aware of the telltale signs can help you identify a potential issue and seek appropriate medical attention. One of the most common symptoms of low testosterone is a persistent lack of energy and fatigue. If you find yourself feeling constantly drained, even after a good night's sleep, it could be a sign that your testosterone levels are out of whack. This fatigue can also impact your mental sharpness, making it difficult to focus and concentrate. Another red flag is a change in your mood. Low testosterone can lead to increased irritability, anxiety, and even depression. You might find yourself feeling more down than usual, losing interest in activities you once enjoyed, or experiencing mood swings. Fatigue is a common complaint, often attributed to stress, lack of sleep, or a busy lifestyle. While these factors can certainly contribute to tiredness, persistent and unexplained fatigue could be a sign of something more serious, including low testosterone. Testosterone plays a crucial role in energy production and metabolism. When your testosterone levels are low, your body may struggle to convert food into energy efficiently, leaving you feeling constantly depleted. This fatigue can manifest as both physical and mental exhaustion, affecting your ability to perform daily tasks and engage in activities you enjoy. If you're experiencing persistent fatigue that interferes with your daily life, it's essential to consult with your doctor. They can help determine the underlying cause of your fatigue and recommend appropriate treatment options. Don't ignore this crucial symptom. Addressing it could significantly improve your overall well-being. Mood swings, irritability, and a persistent low mood can be incredibly frustrating and debilitating. While these emotional changes can stem from various factors, including stress, life events, and underlying mental health conditions, low testosterone could also be a contributing factor. Testosterone plays a role in regulating mood and emotional well-being. When your testosterone levels are low, you may experience a heightened sense of anxiety, irritability, and even depression. This can manifest as feeling more easily frustrated or agitated, having a shorter fuse than usual, experiencing mood swings and emotional outbursts, and feeling sad, hopeless, or lacking motivation. If you're experiencing significant changes in your mood, it's crucial to seek professional help. A healthcare provider can help determine the underlying cause of your emotional distress and recommend appropriate treatment options, which may include addressing low testosterone levels. In addition to impacting your energy levels and mood, low testosterone can also manifest in physical changes. These changes can be subtle at first, making them easy to dismiss as a natural part of aging. However, paying attention to these signs can help you identify a potential hormonal imbalance. One of the most noticeable physical changes associated with low testosterone is a decrease in muscle mass and strength. Testosterone plays a crucial role in building and maintaining muscle tissue. When your testosterone levels decline, you may notice that it's harder to build muscle, even with regular exercise. You might also experience a decrease in overall strength and endurance. Another common physical change is an increase in body fat, particularly around the abdomen. Testosterone helps regulate fat distribution in the body. Low testosterone can lead to an increase in visceral fat, the type of fat that accumulates around your internal organs and is linked to an increased risk of heart disease and other health problems. If you suspect you might be experiencing low testosterone, the first step is to get tested. Fortunately, determining your testosterone levels is a relatively simple process. There are two main ways to test your testosterone: through a blood test or a saliva test. A blood test is the most common and accurate way to measure testosterone levels. This involves a healthcare professional drawing a small sample of blood from your arm, which is then sent to a lab for analysis. The results of your blood test will show your total testosterone level, as well as the levels of pre-testosterone and bioavailable testosterone. Saliva tests are a less invasive alternative to blood tests. These tests involve collecting a sample of your saliva using a special kit. The saliva is then analyzed to determine your testosterone levels. While saliva tests are generally considered less accurate than blood tests, they can be a convenient option for home testing. With the rise of at-home health testing kits, it's easier than ever to check your testosterone levels from the comfort of your own home. But are home tests a reliable alternative to visiting your doctor? Home testosterone tests can be a convenient and affordable option for getting a quick snapshot of your hormone levels. These tests typically involve collecting a saliva sample and and sending it to a lab for analysis. You'll receive your results within a few days, often along with personalized recommendations based on your individual levels. While home tests can be a helpful starting point, it's important to remember that they are not a substitute for professional medical advice. If your home test indicates low testosterone, it's crucial to follow up with your doctor to confirm the diagnosis and discuss appropriate treatment options. Your doctor can perform a more comprehensive evaluation, including a physical exam, review of your medical history, and additional blood tests to rule out other underlying conditions. Based on their assessment, they can recommend the most effective course of treatment for your individual needs. While medical treatments like testosterone replacement therapy are available for those with clinically low testosterone, there are several lifestyle modifications you can make to naturally boost your testosterone levels. These changes can have a significant impact on your hormone health and overall well-being. One of the most effective ways to naturally increase testosterone is through regular exercise, particularly strength training. Lifting weights and engaging in resistance exercises stimulates testosterone production, helping to build muscle mass and strength. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Another crucial lifestyle factor is diet. Consuming a balanced diet rich in protein, healthy fats, and complex carbohydrates can help optimize hormone production. Focus on incorporating lean protein sources like chicken, fish, and beans, along with healthy fats found in avocados, nuts, and olive oil. Limit your intake of processed foods, sugary drinks, and unhealthy fats, as these can negatively impact testosterone levels. If you've noticed any of the symptoms of low testosterone or have concerns about your hormone levels, it's essential to seek professional medical advice. A healthcare provider can help determine if your symptoms are indeed related to low testosterone and recommend appropriate treatment options. Don't hesitate to reach out to your primary care physician or a specialist, such as an endocrinologist or urologist who specializes in hormone health. They can provide personalized guidance and support to help you regain control of your health and well-being. Remember, seeking help is a sign of strength, not weakness. By addressing your concerns and seeking timely medical attention, you're taking a proactive step towards living a healthier, more fulfilling life. If you have watched until the end of this video and think you've learned anything new or anything of value, please don't forget to press the like button and subscribe to the channel to stay up to date with all the videos. Don't forget to press the bell icon as well. Stay safe, stay healthy,